Hello and welcome to Budget with Business Standard. I am Ruchika Chitravanshi. In today's episode, we are discussing two of the most crucial issues for the development of any country: health and education. The government has been talking lots about it, and we will discuss today what can the budget offer. But first, let me introduce you to my guest today. We have with us our health correspondent, Sanket Kaul, and our senior editor and energy sector specialist, Shreya Jain. Let me start with you, Sanket, first of all. A broad question. What can the budget do for the health sector this year? We are expecting an increase in allocation, lots in the BJP manifesto also. Or what is it that you're hearing from your sources?
Well, the first thing that the sources are indicating is, of course, that there is going to be an increase in the outlay for the health budget. If we look at what the interim budget gave us, well, for the health department, we had around 90,000 crore rupees. This time, many analysts and, of course, sources in the ministry are speculating that it may go above 100,000 crore, maybe 1 lakh crore rupees. And this will primarily be fueled by the increase in PMJY, Ayushman Bharat Yojana. Well, it was manifesto promise from the Bharatiya Janata Party that if they come to power, they'll be covering all the people above 70 years of age and everyone from the transgender community in the Ayushman Bharat Yojana. Currently, it gives 5 lakh rupees insurance coverage to around 340 million people who have got PMJY cards. With this addition, we are expecting around 500 million people to get this coverage. In the interim budget, it was around 7,200 crore rupees which were allocated for this Yojana. And with this addition, we are expecting that it will go beyond 9,000 crore rupees. So this will be a major boost for the health expenditure. Other than that, then there is the center's focus on non-communicable diseases, especially hypertension, diabetes, which are around 60% of all of the deaths that are happening in India right now. Then there is a new disease that has come into the market, which is the antimicrobial resistance. In January this year, the Director General of Health Services had specifically given out a letter to all the pharmacists to not dispense any antibiotics without any prescription, because India is now seeing an increase in cases of antimicrobial resistance when even after taking antibiotics, people are not getting well. Apart from that, we are going to see expenditure for building of new AIIMS as well. 6 AIIMS were inaugurated this year. We are expecting that around 4 more are in the pipeline. So this will be the major focus issues for the health budget.
So, more health infrastructure. Of course, you mentioned the antibiotics, and there's so much focus of this government on Ayurveda and all as well. Shreya, what do you think beyond what Sanket is talking about, Ayushman Bharat scheme, etc., and building more AIIMS and also to bring more manpower in the health sector? What is it that the government should focus on?
Very rightly, Sanket has pointed out, and some good information he has with him. Over the years, there has been criticism for repeated governments, not just this government, previous government as well, that the budget outlay towards the health sector or education or the social sector has remained minuscule. I'm sure Sanket would have some stellar data to go with it, but it has been minuscule, and that has been criticized because for a country that is aiming development, as you said, Human Development Index plays a huge role, of which health is in the first line of defense that is there. So we have seen some improvement in our Human Development Index, apart as UNDP comes out with the figures. But to have a odd 130 rank out of 190 countries is not something to boast about. As Sanket pointed out, and as we have been reading in our newspaper as well, that there is a need to put our health infrastructure in place. There has to be better public health facilities. This year specifically has shown us that lack of public health infrastructure depletes your ability to tackle conditions which are new for an economy to deal, one being global warming and climate change. This year has been immensely, intensely hot. Then there is an expectation, there's a fear rather, of development of communicable diseases because it's going to rain so much. It's a heavy monsoon year. It's raining in May and March and April in Bangalore and Northeast when it doesn't rain. It's so much hot in Delhi, and public health infrastructure is the first line of defense towards it, and it needs to bolster. A lot of Sanket's reports pointed out how hospitals were caught unprepared for tackling cases of heat strokes, etc. So I think there should be a focus, there should be a lens on how public health infrastructure is built in the country. And I think through this budget, center should show a way for states also to follow that.
Because it is, in fact, in the concurrent list, and
Yes.
both states need to increase their health expenditure. Shreya, you very rightly pointed out all these issues related to global warming, the heat stroke that people have suffered this summer, the toll that pollution takes on our health. I mean, we don't talk about it. Health has been in focus much more after COVID in the post-pandemic. Right. So, do you think there is like a major shift now, and how do we need to prepare for the next pandemic from now onwards itself? What are some of the things that we should build on? Sanket, you can also take this question.
Pandemic has been a big lesson across the globe. The science community has been warning all the nations to be prepared for another such pandemic. The community also seems to suggest that global warming, climate change, and extreme weather conditions would create unprecedented situation. We would hear about health pandemics that we have not heard before. And I think that states and center should work together. Cooperative federalism, as this government seems to talk about. We have to have a climate action plan. There have been reports where states have been asked to prepare a health plan keeping climate change in mind. We have to have a long-term plan where we devise a method where we should have a public health infrastructure. Last month or so, me and Sanket talked to experts all across the country with hospitals, public health experts, virologists, etc., where they seem to have suggested that short-term plans are good for hospitals, for states, but each and every state, district-wise, should have a long-term plan with data available on climate, meteorology, etc. There should be much more R&D and testing on upcoming virus, etc., so that this country is prepared for any unprecedented event that comes to us.
Sanket, as Shreya has talked about, the development that the kind of budgetary resources also that need to go into research and development, very crucial for health sectors. What more do you think that the budget can do in terms of promoting research? What are some of the challenges it can address? And if you can also touch a little bit upon, preventive healthcare and women and child healthcare, what do you think that the budget would do? Because I'm also asking this because everybody has been talking about FM and PM and precedent of poor youth, farmer and women. So, somewhere health is also an issue that needs to be addressed here.
Talking first about the R&D and skilling issue, I think one of the major critics of this government's health policy has been that funds for ICMR have stagnated really. Year on year, we have seen more or less the same amount of funds being given to the ICMR, which is the premier body of health research in this country. We are expecting this fund to go up this year because after COVID, there has been a significant push for health research, and we are also going to see an increase in fund for the consortium of virology labs INSACOG, which had worked day in and day out during the COVID pandemic. Apart from that, of course, there are many issues on the ground. One of the biggest issues is the implementation of Ayushman Bharat. Many hospitals have complained that the rates are too low, and panel hospitals are not, covering their costs of the treatments that they're giving under the scheme. Secondly, there's a lack of private participation because they're not seeing that incentive of participating in that scheme, big private hospitals. Thirdly, all the empaneled hospitals, apart from the low rates that are there, they're also facing the issue of delays in reimbursement payments. So whatever money they are to be reimbursed, they give those claims to the government, it takes more than a month for them to get it back. In fact, it's in the paper as well that for every week that the payment gets late, you're going to get an interest on top of the reimbursement payment. They haven't got that as of yet.
Sanket, I also wanted to talk to you about the education, which is another pillar and which is another big issue that we need to address, right from primary level to skilling and overall education. What is the sense you are getting of what the expectations from the budget is and what the government can do?
We are expecting that there will be a small increase in the education budget. Last time it was around 1.2 lakh crores, including both the Department of School Education and the Department of Higher Education. A lot of effort is being put into the Department of Higher Education because it includes all the IITs, the IIMs, the IISCs as well, and we are expecting funds for these autonomous institutions to increase, and also there are some new IITs that are going to be built this year, as has been announced in the manifesto of the Bharatiya Janata Party. So keeping that in mind, we think, and from what the sources are telling us, there is going to be a small increase, but most of it is going to be focused on the Department of Higher Education.
What is the industry expectations? Is there something they are asking for, especially in terms of the new education policy that has been under discussion a lot?
Yes, so in fact, many universities have said this, and there was this pre-budget meeting with the finance minister where the education bodies had requested the finance minister to include a special cell within the education ministry so that the states which are finding it difficult to implement the new education policy would understand its implications and how to implement it properly. So this special cell is being one of the core demands to implement the national education policy. And I think that would also be the push of this government, because the national education policy has been one of the major schemes that they've launched. And so they'll be pushing towards it as well.
Shreya, if I can bring you in on this, because this links so much with our, the whole issue around jobs that we have in our country, the skilling issue. What are your observations?
I think over the years, this country had a lot of fantastic programs on education, be it Sarv Shiksha Abhiyan, NCERT keeps on revising its syllabus and it's in sync with global standards now, the national education policy. But I think there is a gap between education and skill development, and it is coming to fore now because now we are a very globally connected country. Our human resources sought after, but that is only a section of our IT engineers, etc. But it's there also that we are seeing a job problem because of the global pressure. We have seen statements recently from major infrastructure companies which are talking about, first, lack of skills, that we don't have skilled labor, people who can be deployed in a manufacturing factory. Second is a major problem that these people do not want to come to metro cities and work for a meager income. Now, the question should be raised to these companies that why don't they increase that income? But do you see that it is a kind of a vortex here? It's a catch-22 situation. The engineers don't think that they are being paid enough, and the companies here say that we are not getting enough people to come and be employed. So I think on a skill development, education definitely laudable efforts, but on front of just a skill development, I think there has to be a broader dialogue between industry, government, state governments, and the center, obviously, when there should be a policy on how do we take this democracy forward, this demography forward. We have such a rich demographic index right now. Our big section of our population is in the workable age group, and that needs to be exhausted as much as it is possible. I'm hoping that the budget realizes it is, because the skill development has been a focus. There has been a skill development policies, etc. The government job has been such a big issue for this government, one of the reasons in the electoral as well. So I am hoping that there should be a focus. We are reading in the papers also. So let's see what happens on that front.
In fact, there's the whole focus that the budget will also talk about is the Viksit Bharat by 2047, maybe earlier. And as you rightly said, this skilling is a big issue, and it's not just engineering, it's health, it's all sectors. It ties everything together. And if India really wants to reap the benefits of its demographic dividend, it cannot do so without a healthy population, without a skilled population. And that's all the time we have for the show today. Thank you so much, Shreya and Sanket, for joining us. Hope you enjoyed. Thank you for watching.